I feel almost like we're in an osteo week because we've been talking osteoporosis, osteopenia. Today we're talking about osteoarthritis with my dear friend and colleague Zora, who now has her own story. It's really funny. We were talking offline and she's like, I interviewed because I was on her podcast, Hack My Age. It's amazing podcast. If you're not subscribed, make sure you do that. And we're talking as we're recording and she's like, I interview all these people who have a pain to purpose story. And she's like, now I have my own pain story about what I've gone through. And Zora, before I bring you into the conversation here, I want to just mention that this is such an important topic for women, especially midlife women, because this is where we start to see the aches and pains, the wear and tear of the years of our body being used and abused, whatever we did. And really these little issues with our musculoskeletal system start to come up. So I'm sorry you've been through hell and back, but thank you, because now you can share your story and all the different hacks that you discovered and how you healed yourself. So, welcome and thank you.
Oh, thank you, Amy. It is a pleasure to be here, and I'm so grateful I get a chance to share the story and share the experience because you feel really alone. It's like menopause, right? You feel alone if you don't talk to people, you don't hear it. And yeah, now I have my own pain to purpose story. Didn't expect this. I honestly been pretty good my whole life. I've been pretty lucky until I hit my menopausal years, and then suddenly osteoarthritis creeps up, and I've learned so much. So I'm going to share all that I've learned because I speak to a lot of women now since I've
Yes.
opened this can of worms up, which I've been very transparent throughout this whole journey for like 2 years now, trying to find solutions, trying to reverse osteoarthritis, trying to find hacks, and they're hacks that work. And they worked a long time for me until they didn't. And I still believe that the body can heal. There are things that you can do. Not everybody's destined to have surgery. Some people do, and some people don't.
Mhm.
And so I'm here to share what worked, what didn't work, what send you down some rabbit holes to go down if you're feeling some joint pain, and when to really know when to pull the plug and let's just get a hip replacement.
Absolutely. Yeah. So, no, this is very, very common. Very, very common with women. So I'm happy that we are bringing it out into the open and that you're transparent about it and then we can actually have this discussion. Because, like you said, you do feel alone. And then I don't know if you felt this way too, but you almost start to go, oh, this means I'm getting old because now I have joint problems. And joint problems used to be just contained to my parents and my grandparents. And now I'm having them. So is that something that kind of messed with your head too?
Absolutely, absolutely. And when the doctor first said, "Oh, you have osteoarthritis," I said, "Osteoporosis?" Like, I
Yeah,
just
yeah.
never knew, never heard that word. And then when they started to talk about replacements, joint replacements, I was 45 at the time, pretty
Mm-hmm.
much, when
Mm-hmm.
people started talking to me about surgery, and I was just laughing in their face. I'm like, "It's not that bad. What are you talking about? And isn't that for people over 70?" And so it is important we talk because as the diseases progress, maybe we should define what is osteoarthritis. It's not osteoporosis, which is the bone density loss, but osteoarthritis is a degenerative joint disease, and it happens when it's the cartilage that's around your any joint, I guess, that in a bone, it starts to wear down over time. And then what happens, you just get pain, you get stiffness, you get swelling, you lose mobility. So when I couldn't open my legs much longer, and I was hyper flexible, like I used to be able to do the splits like no problem.
Yeah.
And so yeah, and then you go, okay, well that this is when you start to have this inflammation. And then there's some doctors like regenerative medicine doctors, which I absolutely love and respect, and they're like, it's not a wear and tear issue, it's an inflammation issue. And yes, absolutely it is. So they may take different paths on how to treat this,
Mhm.
but osteoarthritis can happen in your knees, in your hips, in your hands, your spine. Knees are the most common. And but for me, it was in my hips. And women also are much more likely than men to get hip osteoarthritis. especially after menopause. So when we lose our hormones, the whole thing progresses fast, really much faster. And this has been exactly my case, despite being on hormone replacement therapy. So we do have a faster progression, and there's a lot of people out there. Like when you dive into this topic, which I did, there are over 500 million people in the world who have osteoarthritis. It's about almost 7% of the whole global population. And we have in the US alone, I was like looking for surgeons, like where am I going to do this? And I started digging deeper, and there are about 400,000 surgeries in the US of hip. I'm talking about just hip osteoarthritis. And then globally, it's got to be probably on the hundreds of millions. I'm not really sure to look up that stat, but I'm like, that's alone in the US. Think about the world population. So it
Right.
is it's pretty prevalent, and you're going to hear more and more about it as we age and as we go through menopause. And sometimes joint pain is not it's not osteoarthritis, it's just your hormones, or it's your thyroid, it's other issues, but it is something eventually go down the road, and you may be told by a doctor that that's what it is. So I just kind of wanted to clear any confusion on osteoarthritis.
Perfect. Now, where did your journey start? So you started with just a little bit of pain, a little bit of
Yeah.
stiffness, and then what? How did that progress to having two full hip replacements?
Yeah, two full hip replacements within 3 months. So I'm 1 week out after the second one, and so it started out where, well, it depends on it depends how far back you want to go. Because let me just tell you first about the risk factors, and
Mhm.
I have, I think, 9 to 12 of them. So just
Oh,
getting older is one,
okay.
being a female is another. Then you have genetics, which my genes are predisposed for that. Obesity, not my problem. Joint injury. Then there's hip disorders like hip dysplasia, or FAI, which has been called hip impingement. So evidently I had two of those. I had the hip dysplasia and the FAI. I didn't know I had hip dysplasia until recently, just like last year. One of the doctors said that, but I'm hyperflexible, and that can mask hip dysplasia. So you don't really know. And then you may have an occupation, maybe you're lifting heavy things.
Mhm.
If you're athletic, which I am, bone deformities, which I had, and that's partly the genetic thing. Some nutrient deficiencies like vitamin C and vitamin D can also be a risk factor. So make sure you take your vitamin C and vitamin D.
Mhm.
Those levels go down. If you're a smoker, this also is a problem, and your hormones, basically menopause, can increase your risk for osteoarthritis. So for me, I had a lot of those. I wasn't obese, and I didn't have smoke, and I didn't have this occupation, but the rest, that's me, without even knowing. And I got through over 50 years without a problem. But to add to that, in the injuries, the joint injuries, which was, I think I torn an ACL in my right knee skiing 30 years ago.
Mhm.
And then what happened, I started to feel the hip pain on the left hip, and then eventually the right hip. And so possibly, I mean, it depends who you speak to. Why do I have this? Why this happens? Well, I may have to be risk factors, but a physio would say, well, maybe you were 30 years compensating microscopically, you were imbalanced, and then that sort of takes this path where maybe your hip and then your shoulder, but it start perhaps with the knee. But even so, let's fast forward probably about 20 years later. I
Mhm.
did a deadlift, and I do remember hearing a snap in my hip. Couldn't move out of bed. But after a week, I went to get an MRI, got all this information. Oh, you might need a hip replacement one day. And this is it was a shock of my life. And ignored that because I went to see a physio, and all the physio, the rehab stuff was working. So that's great. So anyone's feeling any kind of joint pain, feeling have been told you've had some impingement, you definitely want to get into rehab, get to a sports therapist and
Mhm.
see. It's usually they're tighten up the glutes, create some space. You don't want to have any of this pinching. This, when I say impingement, it's like a pinching feeling when you bend. Does that
Yeah.
make sense so far?
Oh, yeah, totally. Like I'm
Okay.
feeling my body when you're talking about that. Like, oh, I got this little pinch over here, and yeah.
I don't want to scare anybody, it can sound scary, like, oh my God, I have all of these, but that's not necessarily, right? So for me, I would say I did a lot of really cool hacks that on top of the physio that worked pretty well. And for me, PRP was buying me a lot of time. And that's platelet-rich plasma therapy. And it's when you remove blood from your own body, you spin it in a centrifuge, and about 15 minutes later, they re-inject it to the site of the injury. It's not covered by insurance because it doesn't work all the time.
Right.
And unfortunately, it's really expensive. So, but if you want to try it, it's one of those things. I mean, you're injecting your own blood. Okay. It's not
Very safe.
yeah, it's not much risk there, right?
Right.
So, and I have recommended it to a lot of people. And to me, it seems about between 50 and 60% of the people who do it do are revived. They're feeling great and it
Mhm.
worked. So it's kind of, you're gonna have to play with that if you want to. Red light therapy was also really, really good when you feel like it's been a hard day. I walked a little bit too much.
Yep.
Doesn't save you, right? But it does help with that, and it relieves the pain. Ice bathing as well,
Yeah.
jumping
Yeah.
into a cold plunge or a cold pool. Massage also, certain types, like more of a therapeutic massage, the kind
Right.
that hurts so bad.
Yep. Yep.
It hurts so good, but so bad. That's been pretty worked pretty well. And I think absolutely everyone needs to be cleaning up their diet, anti-inflammatory diets, whatever that means to you. You can find out what that is, but eating the whole foods, but things that are not going to cause even more inflammation. You are already inflamed. You need to pull that down.
Hmm.
And there was one amazing drug that I tried, Dr. Elizabeth Yorth from
Yeah.
Boulder Longevity Institute. I went to her. I was like, they're going to fix me and save me. It's going to be her.
Yeah.
And she's brilliant. I know you've had her on your podcast, right?
Almost. I'm interviewing her
Oh,
beginning of February. I can't wait.
oh,
Yeah.
oh, she's just, I can't, guys, tune in for that because she's just chock a block full of information. She's so advanced. And she gave me pentosan polysulfate, which is
Oh.
a drug normally used for horses
Okay.
who have
Yeah.
hip issues.
Yeah.
But they've created a formula for humans, and they've done some human trials, and they seem to work with her patients. 80% of the people are recovered from osteoarthritis, and it's amazing. So, and there are a lot of other great side benefits other than just reducing inflammation.
Hmm.
So I gave that a good go over the course of a year. It took me a long time because I had to get the drug um,
Yeah.
into Spain. I had
Yeah.
to find out how to get this. So if you are actually in the US, you can try this out very, very quickly, see if it's an effective solution for you or not. But pentosan polysulfate, I think it's called Zilosul, I think, if I'm correct,
Mhm.
the human form. But you absolutely need to see a doctor for this because it's a drug. But that's definitely the doctor to go to and try. I really think that if I could have found the right treatment the earlier, maybe I would have either bought time or I would have maybe if avoided surgery altogether. But it got to the point where, as I was working with her, we tried this, and she looked at my scans again, and she's like, you're going to be the one that needs the surgery. But I really had confidence with her because I felt that if I needed it, she would tell me the truth because she's doing all she can to avoid surgery.
Yeah.
Absolutely. And she's got tons of hacks. And she gave me some fabulous protocol pre and post surgery that I'm going to share with you that I think everybody should like literally get a piece of paper and pen and write these things down, research them, ask your doctor about them, and try them if you are getting surgery. There's some really, really important things that we need to do. So
I love
that
this.
was my story. I eventually, yeah, did the surgery. I'm so happy it's behind me. When you decide to get surgery, it's like you go all in and you just can't wait. I've been trying to avoid it for so long, and we did ask about, you did mention, does it make you feel old and does it mess with your mind? And absolutely. And when I saw myself feeling, not only feeling old, but also you get into a very negative mindset, And I noticed it and I said, this is really bad for the rest of the body. It's in my head. And now I'm going to be paying a price with other health issues if I don't take care of it with that now. And I know that there are other people out there who are podcasters, who are influencers, and who hide this and they're in their 50s. And I'm like, that's the wrong thing to do. And they'll talk about it after the fact. And really, I really want to be here. And I really am grateful to you, Amy, for allowing me to use this platform to open this up and say, I'm 54. It happens, but we can do so much about it.
Yeah. Yeah, I'm so happy. I'm so happy you're here. Now, real quick question. Did you ever, and I thought about this back when you were talking about PRP, did you ever try stem cell therapy? Because my dad did for his ankle. He did the prolotherapy, PRP, then stem cells. The stem cells did work better than the PRP. It still looks like he might need surgery. So yeah, but it definitely, it helped tremendously. Did you try that?
The stem cells, I was on the brink, but it
Okay.
was about a 15 or $20,000 investment, and I wasn't ready to do that.
Yeah.
And if I were going to do it, I was going to do it in the US, and I was just abroad. And I thought, okay, and I was already running out of time. But what I would have tried if I had more time sooner than stem cells would be exosomes.
Oh,
Exosomes are cheaper,
yeah.
they're safer, they don't carry the DNA, and
Mhm.
they're evidently supposed to be just as effective, if not more, than stem cells. So I don't know why. I would have almost your dad try exosomes first
Okay.
or next.
Okay. Very interesting. All right. That's helpful.
Yeah.
So, okay. So you have the surgery. Well, first of all, before we even get into that, I want to go back to something you said in the beginning about aging and loss of hormones as being a risk factor, but you were on hormone replacement therapy. When did you start hormone replacement therapy? And can you talk a little bit more about which hormones are so vital for keeping our joints healthy?
It's good you asked because I started when I was 50. However, I started on baby doses. I didn't know what I was doing at the time, and I wasn't with a doctor who really understood what was going on. And they didn't
Mhm.
really want to give me, but they kind of did. And I
Okay.
started out with just, it was estriol in a pessary, vaginally. And
Mhm.
then eventually I added on a little bit of progesterone. Eventually, I added on some estradiol at a very low dose. So I think one of my big mistakes was I started too little, too late. And maybe if I were in better dosages, I would have been more helpful. And the big one is estradiol. So we want to have estradiol. That's the one for building and regenerating, and it's for helping with it's with the bones for sure as well. We have progesterone, who's balancing things out. So if you're on the estradiol, you do need to be on the progesterone for sure.
Yeah.
But the big player is estrogen, because estrogen is an anti-inflammatory, right?
Yeah.
So really talk to your doctor if you are considering bioidentical hormones, right? We only want the bioidenticals, and you have some joint pain. I have worked with so many women who complain about joint pain very lately in their hands, most in their hands or their shoulders.
Yeah.
And the moment we get them on bioidenticals, they're just shocked and amazed at how liberated they are and how this pain is gone. So it's just one of the first lines. It's such a low hanging fruit to do if you've got joint pain. And you're a woman going through this transition, you've tested your hormones, they're all gone. Just try it. You can always go off of it. Like if you don't
Right.
like it,
Yeah.
just go off, right?
Yeah. Exactly. Exactly. It is so much worth it. Well, because hormones keep us young. They give us life, and that includes our joints.
Yes.
So, yeah, that totally makes sense where you were probably noticing a decrease in progesterone and estrogen 40s, late 40s. So then starting on that baby dose, yeah, it helped, but it didn't the damage was already occurring, would you say?
Exactly. That's my opinion. I think
Yeah.
that's definitely.
Yeah.
And I wish I knew. I didn't know. I didn't know
Yeah.
back then. And I didn't have the doctors who knew as well. So I'm here to tell everybody, just now you know who to go to and what to do and what to consider.
Yeah, absolutely. So, okay, so you make the decision that, all right, we tried these other things and the pain is still there. It's
Mhm.
time for surgery. So, what did you do, first of all, to prep your body for surgery? And, let's face it, one of the beauties of us having a podcast is we have access to a lot of smart people and that we can tap their brains and tap their hacks and their biohacking techniques. So, what did you do to prep your body for surgery? And then I want you to get into the post-surgery recovery hacks that you did.
It's so important. Pre-surgery is so important. I meet too many people who are about to go get surgery and they just let it all go and they're like, it's going to be replaced. But no, you want to have a very quick recovery. So if
Mm-hmm.
you want a quick recovery, you still need to do the preoperative stuff. And like you said, I tapped into all of these brilliant minds, all these brilliant biohackers, all these people who could help me through this. And so I'm passing this on. So get your paper and pen again, and we're going to start with the nutrition first of
Yeah.
all. It's kind of an obvious one, but we want to get protein in, and if you got to eat more, even more than it's your job, or even more than you normally do, and so I was going up to 2.5 to 3 grams per day, per kilogram of per pound of body weight per day
Okay.
because
Yep.
it is a lot. And I would supplement with essential amino acids because I just
Yeah.
couldn't. It was just so hard. But I did prioritize protein. But all throughout the last 2 years, where I've been told I cannot do impact exercises, I can't do running, I can't do anything that brings me joy, I can't even lift heavy. I had to really I was stuck with rehab exercises, boring mobility exercises.
Yeah.
And I maintained my body composition. I've even built muscle. And I'm going to tell you how. And nutrition is a big piece of that. I never changed the amount of protein all those last 2 years. I would always eat about, I don't know. For me, I'm 50 kilos, like 110 pounds. I've lost actually some weight because it's just muscle mass altogether since I was really fit.
Mhm.
But I kept the protein amount pretty stable. It's just pre-surgery, then I bumped it up but I only had I only had 2 weeks before in advance notice to do that. So
Oh,
um
yeah. You had
it,
to, yeah. You had to
yeah.
prime your body quickly. But when you're basically taking care of yourself like you do, that's not that hard to do.
Yeah, no. It's yeah. If your diet isn't cleaned up, you got to clean it up now. You get your whole foods, your fruit and your veg. You get your
Hmm.
protein in. Really dial in. Now is the time to dial in your diet, and it's not just increasing protein. We want to clean out the processed foods. We don't want to keep adding more inflammation. So please just focus on getting good food into you, a lot of good
Hmm.
nutrition. And then when it comes to exercise, you got to do whatever you can. And just like you said before, so you can exercise other body parts that are not in pain, right? If you have hip pain, you can also work your upper body. And if you have shoulder pain, you can work the lower body. Do whatever you can. But you have to be always without pain, right? You never want to go into the pain.
Yeah.
Stick with your rehab exercises. Go see if it's worth paying somebody to try to guide you on how to have the correct form, even though it feels like nothing. You're not sweating anymore. You're not doing anything really. You got to keep that up. And one fabulous hack that I found, in addition to my rehab and little that I could do, was katsu bands. These are blood flow
Yeah.
restriction bands. And it doesn't have to be Katsu. Katsu is a brand, but I like the fact that they are cyclical in nature, that they inflate with air and then they
Yeah.
deflate. And these are basically bands that you put on your arms or your legs, and you just putter around the house. That's pretty much what I would do. Putter around the house and then
Yeah.
sometimes do my mobility exercises. And that increases growth hormone and it increases blood flow. It helps so much maintain muscle mass. I think that was also a key player for me in sort of exercise component.
So real quick on that, I've played with the Katsu bands, but I have not dove into the science of them. I know that when I put on the band and I restrict, and then let's say I do a bicep curl, I get this huge pump, but you're even saying just the process of putting on the Katsu bands, having them kind of, and what ends up happening is they inflate and they compress and then they deflate and they release. So it feels like someone is like cutting off your circulation and then the circulation comes again. So even just that process does increase growth hormone. You didn't actually have to like flex your arm or
No,
contract or anything, right?
not at all. And there's an interesting
Okay.
study that Katsu did with a 104-year-old woman. I mean, she's not doing bicep curls. She
Yeah.
increased her muscle mass. I mean, that's
Oh my gosh, that's
incredible.
crazy.
So,
Okay.
yeah, when I found out about, well, first I didn't know about Katsu. I just learned about blood flow restriction, which it's been in the bodybuilding world forever. I
Yeah.
didn't know. But when you Google blood flow restriction, you find bodybuilders, and then you find the rehab people. People are dealing with people who are injured, who just had surgery. And this has been my case. I couldn't do anything really for 2 years. And so that's where it's a really, really useful tool. Now, if you use it while you're exercising, well, it's a bonus, right? You get a little extra gains with that.
Yeah.
So, and I think during COVID, a lot of people, bodybuilders, kind of resorted to some of those bands because you couldn't go to the gym and you don't have more than some baby weights at home. But when you have the constant restriction, not the katsu where it's the cyclical, it feels like you're lifting a truck when you have a little baby weight. You're like, this is heavy. And it's
Yeah.
because it is constricting, it is much longer. So it's harder I think it's harder when you have the constant pressure. That's why I really like the cyclical one. And when I found out about this, I thought, why aren't gerontologists talking about this? Because you can't ask my 85-year-old father-in-law to go lift heavy weights. He will not do that. No way.
Right.
But he
Right.
can slap some bands around his arm. And I mean, of course, without, as long as you don't have any contraindications, and you get the guidance with, some professional. It's not like you just, please don't buy bands on Amazon and give it to your father-in-law, because we don't want to do that.
He'll be
Do your
cutting off
research.
circulation and yeah, yeah, not
Yeah.
good. Right.
Yeah. So that's been a really cool hack. And I'm just such a fan because it saved me so much. And I'm able, because when you go into an operating table full of muscle, your rehab will be so much shorter. You will
Mhm.
recuperate so much better. And I'm telling you, with a hip replacement, you get one done, you rely a lot on the other leg. And so
Yeah.
you're doing like pistol squats because you're trying to pick something up off the floor.
Yeah, you really are. Oh my gosh, I didn't even think about that. You got to hold your one leg out and just go down. Oh my gosh. That's true. I didn't
Yeah.
even think about that.
Yeah. Well,
Yeah.
I didn't think about it either. You don't know it until you do it. I mean, I've been getting really good at putting my slipper on, my shoe, or my sunscreen on with one foot and doing it on the other one. There's a lot of things that you realize, wow, it's so good. I have my muscle.
Yeah.
So yeah, that's why you want to dial in the nutrition, the protein, and your exercise. And then there's some supplements that I think are absolutely important
Mhm.
before and after. The essential amino acids is a game changer for
Yeah.
people who find it hard to eat protein. And I saw on your website, you've got the protein, and you have a whole EAA profile.
Yeah.
Um, is that, or you have the whole, sorry, you have this whole amino acid profile, but
Yeah.
how would that one compare to essential amino acid? Like, could we use that as an essential amino acid? Or do we
You
have to put that on
can.
top?
Well, yeah, so you definitely can because you have that whole amino acid profile in the protein. But I love Keon aminos. I stack the Keon aminos on top of my protein powder, and like I'll do a 2 scoop protein shake in the morning, and this is even like on the regular. This I would step it up a whole nother level if I had surgery. So 2 protein shake in the morning, and then I'll just throw in amino acids into my water all day long. So it's like I have a continuous flow of aminos. And then even if I end the day, I don't think you can get too many aminos. I really don't.
No, No, I also interviewed Angelo Keeley from
Yeah.
Keon, and I
Yep.
asked him because I was just after the surgery, the first one, and I said I was kind of pounding this 3 times a day. I wasn't sure if that's safe. And he's like, the research shows you can do 10 or more. I mean, he's
Yeah.
like, don't go to town, don't worry. So like, and it's so tasty that it's like, oh my God,
It's
I
so good.
hate amino acids. Essential amino acids taste horrible, but this one. So good.
You're right. You're right. I remember my bodybuilding days of amino acids and like, gosh, if they sat in your water bottle for more than 5 minutes, you're like, oh, these are horrible. But no, I mean, I look forward to I'm like, I need to flavor my water. I'm going to put some key on in here. So
I
yeah.
flavor my yogurt. I flavor my smoothies. I flavor
Oh,
like
your
everything.
yogurt. That's a good idea. Uh-huh. I like it.
Yeah, it's
Yeah.
great. So this is what you did. You described your mornings is exactly what I was doing as well pre-surgery. Is I
Hmm.
got the essential amino acids, the whey protein, the creatine monohydrate, which you got as well.
Yep.
Collagen, you got collagen
Collagen.
fixer.
Yeah.
I love that you have Fortigel in there because I always recommend people to get the Fortigel trademark in their
Mm-hmm.
collagen. And urolithin A is another great one for to
Yeah.
keep muscle strength.
Yep.
And I use the MitoPure, and then bone supplements I think is a really good one to get in right now. They're cutting your bone and they're sticking in a piece of metal in there, and you need to be able to have the bone, at least for me, bone grow around it, because some people get cemented in, and usually older adults would get cemented in, but if you're
Yeah.
younger, you have to have your own bone grow around it. So
Yeah.
you need your hormones, yeah, and then you need a good bone supplement. I didn't see a bone supplement on your site, right?
No, no, I haven't gone down that. I leave that for the bone experts. Again, like Kevin Ellis, he has his own line. I don't know if you have any bone supplements that you recommend.
I the one that I know is quite popular. I follow Dr. Doug Lucas, and I was
Yeah,
also,
Doug. I love Doug.
yeah,
Yep.
he's great. He recommends Algae Cal, and there's like two types of Algae Cal. So you just go to that website. I'm sure he has a discount code for you somewhere. But it's got basically calcium, magnesium, vitamin D3 and K2, vitamin C, boron. Um, these are kind of the big ones, and there's a bunch of other stuff, and then algae in there. Interestingly enough, that's why it's called Algae Cal.
Yeah.
So get yourself a good bone supplement. Start taking that
Mhm.
pre-surgery, and minerals. And I'm a big fan of Beam.
Beam. Yep.
Yeah.
Yeah.
So that's an easy one. I love that you can drink it, but you need minerals. You need all these things to grow your bone and support your muscles and support this pre-surgery. So I would do all those things too post-surgery, but I'd add on a couple of other ones. But I want to share a hack that I learned from Dr. Jen Simmons
Okay.
about X-rays, because when you're going to get a surgery, you probably need an X-ray, and that's
Yeah.
radiation. And so what she recommends, and I did this, it's kind of crazy. Um, it's about, let's see, it's 1 hour before the X-ray. You take 1 to 2 grams of liposomal vitamin C,
Okay.
easy,
Yep.
and 100 to 200 milligrams of melatonin.
Melatonin.
Yeah.
100 to 200 milligrams. Didn't
Yeah.
that make you go to sleep?
Well, I had to do it again 3 hours after the x-ray. And then you do it for 3 days after. So I popped it all. So in one day, I decided to take a little bit more. So I took about 260 milligrams of melatonin. And the most I ever took before was 10 milligrams, and nothing happens to me. So I kind of went in there like, nothing's going to happen to me. I
Yeah.
seem to
Yeah.
be immune to melatonin. And actually, I did really well. There was one point I was on the computer and I was getting really drowsy, and then I got a second wind.
Okay.
But I did wake up very groggy.
Well,
But
yeah, it's going to have a lingering effect, but so the concept is that that's protecting you from radiation.
yes, yes, and
Okay.
it's an ant. These are like high dosages of antioxidants. That's
Sure.
her theory. Okay,
Okay.
and yeah, and the way to offset the grogginess is you just go outside and get your eyeballs full of sunshine, and you'll be fine.
Sure.
But yeah, and when I interviewed her, she's like, "You'll be fine. You'll be fine. You won't feel. Don't worry. You can drive." so
Yeah,
so
no, that is true though, because melatonin being an antioxidant, like you said, sometimes I have seen protocols of using melatonin during the day to actually improve your sleep at night. So it's not that you're using melatonin in the day to take a nap. You're actually
yes.
using it to reset your own body's melatonin production. So that'd be a whole other podcast, but I have heard of that.
Yeah. Yeah. And it's a great antioxidant. And melatonin is not just for sleep, right? But there's so many other benefits and so many reasons we have melatonin, which we won't get into, but it's a great thing. Don't be afraid of melatonin, guys. I grew up thinking, oh, be careful. Don't want to do,
Gonna
don't
shut
rely
down
on
your own. Yeah, yeah,
melatonin.
exactly.
Yeah.
Yeah.
And the other thing I really want to stress pre-operation, especially the night before, is please get a good night's rest. Okay. You're going to be stressed. You're going to be very stressed. And as brave as I am, I was very anxious.
Yeah,
I
absolutely. You're gonna
you
be,
want to
yeah.
you're excited to do it. You want to do this. But I was waking up several days before the operation at 2 a.m., my mind thinking, oh, what's it going to feel like? Is it going to hurt? What if I wake up in the middle of like all these questions? It was horrible. And
Yeah.
I don't ever experience anxiety, but I had this feeling in my chest. And it's the way people describe anxiety. It's like, I think I have anxiety
Yeah. Yeah.
because
I think I'm
it would
dying.
be very logical.
Right.
And so at the time, I don't know what struck me, but I contacted Newcom, which is neuroacoustic software, and it's supposed to bring the mind into a meditative state, in a relaxed state. And I sent him a
Mhm.
message like, "I'm getting an operation," like because I was thinking, I don't know why, because I thought maybe if I listened to that during the operation, it'd be like fine, because they just sedate you, they don't put you out. They said do it every day. They have a journey called rescue. Just do rescue, rescue, rescue. And I did. And I
Okay.
started to feel that pain go away. And that the night before the surgery, I slept like a baby. I was so happy. I woke up so refreshed. I couldn't believe it. That pain was gone. And I went to the hospital like so chill. And I kept doing it because I was afraid to stop. I kept putting these
Amazing.
things in my ear all the way in the car until I arrived while I was waiting, until I did it. And the funny thing, Amy, is that I woke up in the middle of the operation.
Okay.
Yeah,
Okay.
totally calm, totally relaxed. Not because of Newcom, I don't believe. I just was so drugged up. But my worst nightmare came through. It came true. And
Okay.
so what the weird thing was that I heard this song and I was like, "Zzz," and I said, oh, I think they're going to cut my bone now. And then you doze in and out. And then I, and then I hear this hammer, this
Oh, good Lord. Oh, come
pounding, and I could feel my leg
on. Oh,
moving
Zora,
with each
you're
time.
killing me right now. Okay.
Uh, you can edit this part out if it's too gross,
Oh, no,
but
no, we're leaving this in. Yeah. You keep going.
knowing me, I was panicking. This is the last thing I wanted. And I was so chilled out. I was curious as if I were looking at somebody else. And then at a point I said, I so that happened. I said, okay, I guess they're putting the implant now in there. And I said, I don't think I should be awake. I don't know. And I tried to speak. I think I grunted, and then immediately I feel the cool coming down my arm and my leg. They sedated me, and in 2 seconds I was out.
Okay.
And I
Yeah.
yeah. At first, when I woke up, I thought that must have been a dream. And the doctor said, no, you woke up.
Hmm.
And
Hmm.
and the scary thing is that it happened again last week. But this time I remember saying, okay, I know exactly what's going on and I want to stay awake for this. And and evidently the doctor said, yes, you had a chat with us. You just said, I'm fine, I'm fine. And I remember thinking, I don't want them to sedate me right now. It's, I don't know, I must have turned into someone else. This is not me. And
Yeah.
I saw the anesthesiologist coming to me, and I was like, no, leave me
Like,
alone.
you're going out.
And he just put me out. And that was it. And so don't be afraid, ladies. If you get a surgery, if you wake up, you'll be so knocked out that it won't even matter. Because I was worried about the body being traumatized if you woke up and this is going to be horrible and I don't want to live this the rest of my life and then have to go to therapy because I woke up in the middle of an operation.
Seriously.
Yeah,
Okay. Oh my
crazy.
God. So,
Sorry,
all
that
right.
was a long
Now the
story.
operation is done. Now, what did you do post operation to speed healing? I know peptides are going to be a part of this. So
Yes.
get into your post-surgical protocol.
Before we do that, take to the hospital because I know in the US it's very often outpatient. Some people have one night. In Europe, I got 4 nights. So
Okay.
yeah, I was like, cool. All right. So then what I did, there's three things I think you absolutely need to bring, and that's your essential amino acids, because you're not going to be hungry coming out of sedation
Mm,
and all these
right.
drugs and all that, but you need your protein,
Yeah.
right? And you probably don't have access to a protein shake, but essential amino
Yeah.
acids like Keon, you just throw it in a bottle of water, you're done. Spirulina and chlorella, I think these are really great because the spirulina, because it gets the nutrients in you. I didn't feel
Mm-hmm.
like eating. I knew I needed nutrients. I just, couldn't take it. So I had
Sure.
these things called energy bits.
Yep.
They're little
Yep.
little tiny, they're like baby size aspirin things, and they have tons of nutrients in there. The chlorella was a bonus because that's sort of a detox. And then the third thing was bone broth. I made my own bone broth and I could sip that easily. And again, this is collagen. This is, again, helping with your tissue and the repair.
Mm-hmm.
So if you do go to the hospital, please take those three things. Um, so the goal post operation is to reduce inflammation. You want to preserve and build back your muscle mass. You want to build bone, and you want to detox. Okay, so these are really, really important things. Um,
Yeah.
there are things like when you're talking to the simple things you'll probably get at the hospital will be you ice your leg. I know in the US you get these crazy ice machines and things that you can wrap it around, and they bring a lot of relief. Red light therapy is another cool one, like if you've got a flex beam or something that you can
Yeah.
put over your leg. That helps with blood flow. And then we have the movement. You got to move. Your physio is going to make you move, elevating your legs, these kinds of things. Patience, and you need a lot of patience, okay? Because you just want to get back to your old self. But before I get into some of the peptides, again, get your supplements, the same ones that I just talked about. But turmeric is another great anti-inflammatory.
Yeah.
NAC and acetylcysteine, fabulous as well. Charcoal, chlorella, glutathione. These are detoxifiers. And I know you've got liver fixer and you got all the stuff right there, which is really,
Mm-hmm.
really good and that you need. And I'm also a fan of the Quicksilver detox, the push catch, and
Yeah.
you got all these
The
binders
liver.
and stuff. If you
Mm-hmm.
can't get that, they've got it's what's in there is mainly zeolites, bentonite clay, these kinds of things. Anything that can bind and get this medication and antibiotics and anti what are they called, anticoagulants, like all these things that, I mean, we need the anticoagulants, but the medications itself, they're probably giving you some sleep medication. Like, who knows what it
Yeah.
went in my body. For me, it was like no questions asked, just give it to me. I don't care. I just don't want to be in pain. We can
Mm-hmm.
detox all that later. So do that. Omegas, your fish oil, you can bring that back in. You don't want to take that just before surgery.
No,
And
right.
I'm very curious, you'll probably know this about more than me, on your website, C60. And I
Mm-hmm.
didn't think about bringing that in, but I'm wondering if that would have been a really good one.
Anti-inflammatory. Yeah.
Yeah.
So huge for inflammation as well. Combating free radical damage, all the crap that they put into our bodies too. Yeah, that's big. So I always throw that into a post-surgical or even post-procedure. Like I'm just getting laser done next Monday. And I'm going to do
Mhm.
pretty much all the same things that you're talking about for a big old surgery post laser because I got to heal. So yeah,
Yeah,
D60. Yeah.
exactly. It's all about healing. So now, if you want to take it another level, okay, these are like the advanced biohacks. You know about this one. It's called nandrolone decant, right?
Yeah.
Or
Yeah.
decante. I'm not sure how you
Yeah.
pronounce it. And it's a steroid, right, to build muscle. But when you use them, this is in smaller dosages and controlled. And I can't remember the amount of time that was given to me. In the end, I couldn't get a hold of it.
Okay.
In Spain, they were like, "Oh, it doesn't exist." But I know
Hmm.
in the US you can. And again, Dr. Elizabeth Yorth in Boulder Longevity, she could get a hold of that, or any kind of regenerative medicine doctor who would know about this. Did you ever explore nandrolone?
No, but I've explored oxandrolone, so it's another
Mm.
loan.
Mm.
And it
I
it
want,
has I've heard Karen talk about this, Karen Martell, that oxandrolone and the nandrolone are very, very similar. I know from my bodybuilding days, oxandrolone being used for sarcopenia originally, Then it kind of transitioned into the girly steroid because it had those anabolic effects without having a high androgenic profile where you would break out and grow a beard.
Oh,
Nandrolone,
wow.
I thought had a stronger androgenic profile. Like we kind of kept that over on the dudes. Like that's
Yeah.
the dude hormone. Oxandrolone is the girly steroid. So I'm
Uh,
not totally sure how they compare.
Interesting. Well, Nandrolone was, but in small, microdoses and
Yeah.
for a shorter period of time. And I can get, if anybody's really interested, let me know and I'll get you the actual dosage that was recommended to me. But just if you want an idea, BPC 157 is a great peptide. It seems like it's for everything, right? And it's not difficult to get. It is it's it's people know it very often for healing the gut and
Yeah.
sealing the gut and gut issues, right? So on the one hand, yes, this was recommended to me to take because, well, my gut is being pumped full of who knows what,
Hmm.
and the antibiotics as well. So we want to protect the gut. So you can even take the BPC 157 pre-operation,
Hmm.
and you can continue on post-operation as well.
Yep.
So that's an injectable in case people don't really know what that was because, and I asked, I was like, I don't want to inject anything else in me. I'm so sick of it.
Yeah.
and and they were like, that's the most effective. And okay, it's just a short period of time for you for this situation, and I'm just sucking it up and doing it. The other peptide that's fabulous for anti-inflammatory as well as building muscle and tissue repair is thymosin beta 4. And again, it comes like BPC 157, a little vial. You take your syringe out and you inject yourself. And that is really, really good and for healing. The other things, this one I didn't get a hold of, but it was also recommended to do cerebrolysin with an IV drip, and it's a neuropeptide. And so this is because a lot of stuff is going to your brain. I guess you
Hmm.
want to protect your brain,
Right.
but it also helps with the healing of the nerves as well as reducing the inflammation. Um, that again, I don't remember the dosages, but that's the kind of thing that it's a kind of an advanced hack here in Spain. They're just like no clue what that is. Um, and methylene blue is another cool, easy hack.
Yep.
Um, and it's people don't know what that is. It's there's many different forms to take it. It started out in the 1800s. I think it was a textile dye at some point,
Yeah.
and then they found out it's actually got some really good properties for medicine. It can cure some infectious diseases and some antidote for cyanide poisoning or something like that. I thought it was blue because of spirulina or something, but
Oh,
it's
yeah.
pure chemical, right?
Right.
But it's interesting. It's still used today in hospitals, and it's not like it's completely. It's not a prescription drug. You can get this online.
Right.
So I've been taking that. It's antiviral, antifungal. I figured I'm in a hospital. I'm there for 4 days. I don't want to catch anything. Let's
It's
heal,
true.
do that. Plus, it's great for the mitochondria. And mitochondria, your powerhouse of the cell, and the whole body just functions even better. So it's just another support mechanism for your healing. That's those are my most those are the most advanced hacks. But you can get all this stuff if you're in the US. It's not that difficult.
Now, did you ever do up like an actual post-surgical protocol download for people? And if not, we
I
can do one up and then I'll put it in the show notes.
I have a blog article. Yeah, I have a
Okay.
blog article with these things. And again with us, so just forgot to mention if you're on any SSRIs, the methylene blue is not for you. And there
Okay.
are some contraindications, and I do have a blog article on methylene blue as well. How it can help with menopause, actually, menopause symptoms is like a non-hormonal, option. But yeah, don't mix this with your on certain medications. I guess it's they may have this effect.
Right.
And then there's the scar. I'm going to end on this
Okay.
because you're going to be left with a scar. Whether and anyone, at least people who listen to my podcast, are getting hysterectomies and mastectomies, and they're getting explants and who knows
Yeah.
what. It's not
Yeah.
just hip surgeries, right? So you want to heal a scar, and so GHKCU
Mm,
is the go-to, and that's a
so good.
peptide as well. And you can get this as a cream or a serum, other things online, and that helps with the collagen production. And so what I do is just keep rubbing and just putting it on. and I alternate with rose hip oil. That's another great oil. And it's the massage manual therapy. And you can just sit there. And I put the timer on for 5 minutes, sometimes 10. Sometimes I'm listening to a podcast while I'm just rubbing it. And because you want to just get that movement, that blood flow. I'm using also red light therapy on it. And then you go into silicone tape. These are things easily find online.
Mm-hmm.
And then there's and that's not too expensive actually. The scar tape is there's something called trofolastin. I know this is what I get in Spain. I don't know if you can get this in the US, but you'll have something similar. And it's called scar tape and it has no active ingredients. So it's not like silicone tape. It's because of mechanical pressure is the reason why it works. It sort of tries to keep your scar being flat, not, becoming raised. And
Mm-hmm.
then there's some moisture that it keeps in there. And then of course it protects you from the UV rays. I mean, it's kind of a weird thing. And it was like $80 for a packet. No, it was like, no, 80 euros. So it's probably $100 for one little packet. So it's expensive, but you can cut them in strips and try and extend the life.
Yeah,
Um, and then there's laser like
sure.
pulse dye laser or fractional CO2 lasers, intense pulse light.
Mm-hmm.
These kind of lasers, any kind of laser you can get your hands on, I think would be good. Probably you find somebody in a dermatologist who can help you with that. And then probably one of the most important things for your scar is to stay out of the sun,
Right.
or cover it. And, just wait for it to heal because then it'll just get darker, and you want it to just get the color of your own skin, right?
Definitely. Yeah. No, I'm glad you mentioned the scar healing part too, because we tend to forget about that. We get through the surgery and then we're like, oh, what am I going to do with this now?
Yeah.
So, yeah. Oh my gosh, this is amazing. What an amazing, I mean, I'm sorry that you had to go through all this, but still, this has given you so much information and experience to now pass on to your audience, my audience, and it's important information. And I just think it's better coming from a person that's been there, done that. It's one thing to say, here's the pre and post surgery protocol, but I haven't had surgery yet, but I just am writing this up. I mean, you've walked the walk and been through it. You can honestly say, yes, this sped up my healing. Because we all know, I mean, the average healing time, as you were even told, okay, well, the average healing time, you're going to have to be, doing this for this long and expect to not do this until this time. And you're probably like, I'm not waiting 3 months. I'm not
Mhm.
waiting 4 weeks to do that or whatever the time frame was. You're going to speed your healing. And I can speak from experience of surgeries and even my husband going through torn patellar tendon, knee surgery, neck surgery, that when I give him these peptides and he listens to me and I do the protein and I do the amino acid, it absolutely speeds healing. It does.
Yeah. And those rehab exercises, don't ignore those. So, most hospitals, I think that's kind of standard of care. They want you moving.
Yeah.
But you're going to heal faster if you just do your exercises as well. So
Yeah.
don't neglect that. And a lot of things we talked about pre-surgery, you continue to do in post-surgery.
I would agree. I would agree with that.
Yeah. Yeah.
Zora, thank you so much for sharing your story and giving us all of these amazing hacks. So tell people what's going on in your world outside of surgery. What do you have going on? Anything new? Any new programs, or at least tell people where they can find you and follow you.
Oh, we've been really growing our membership group. Actually, if anybody wants to jump on in, it's called
Right.
Biohacking Menopause because the website and the podcast is all about biohacking menopause, right? Not just
Right.
the average information that you get. And we have a wonderful group of women who are really quite advanced. I mean, they know a lot, and actually, they're so supportive. It's a wonderful group. So I'll give you a link to join. It's so nice, so fun, and we're doing some challenges as well, depending on the symptoms that our women are experiencing, and that's like the newest and the coolest thing that I've got going on right now. And then, of course, the podcast. Everybody come and listen to the podcast with great guests, including Amy, and it's just so much fun. I love podcasting. Great wealth of information.
It's so much fun. I know conversations like this, we learn and then our audience gets to learn as well. So I love it.
Yeah.
Absolutely love it. Well, Zora, thank you so much for your time today and your story. And of course, you'll be back on because we're colleagues, we're friends, and we like chatting and learning from each other. So We'll have you back on
Oh,
for sure.
thank you so much, Amy.
All right, my dear. Have a great day. And everyone, thanks for listening.